How in the world is it the year 2025 already? If you want to make 2025 the year you do not visit the ER and you do not pass another stone, make sure to register for my free webinar coming up, How to Make 2025 Kidney Stone Free, on January 9th at 12 Eastern. Head to www.kidneystoneclass.com to register to join live, and be sure to get a link to watch the recording. I hope to see you there.
Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 77th episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today we are talking about a condition that is very rare, but comes up a lot in my content, and I get a lot of questions about it. And so I wanted to kind of address it in a podcast. And that is the topic of a health condition called MSK, or medullary sponge kidney. It's also known as medullary sponge disease, or MSD. They're the same thing. So they just kind of have two different names. So either medullary sponge kidney or medullary sponge disease. So for those of you that aren't familiar with this condition, MSK is a congenital disorder. It impacts very few people, about 1 in every 5,000 people in the U.S., and the estimates of the prevalence of MSK in other countries is about the same. So it's really not very common anywhere. And it basically, this disorder results in really small cysts from 1 to 8 millimeters in your kidneys. And there's a ton, like thousands of these tiny, tiny cysts in your kidney. And it makes your kidney kind of look like a sponge. So hence the name medullary sponge kidney or medullary sponge disease. And all of these little tiny cysts make it really, really hard for urine to get out of the kidney, because it kind of messes with the normal flow of that urine. And that one of the hallmarks of medullary sponge kidney, one of the biggest complications of it, is actually a very high rate of kidney stones. Up to 70% of people with MSK will have at least one kidney stone in their life, which is pretty notable, because when we look at the prevalence in the general population, so people without MSK, just looking at everyone, only about 10% of people will have a kidney stone, which is still very, very high. I will note 10% of the population is a huge number, but obviously 70% of the people with MSK forming stones is very, very high. I wanted to share just kind of some more interesting facts, because I know that once you learn about a condition, you're kind of like, tell me more about that. So, some interesting facts about it is that MSK can actually affect just one kidney. Typically, around 70% of the time, it impacts both of your kidneys, but it can sometimes just impact one of your kidneys. It's typically diagnosed later in adult or into adulthood, not later into adulthood, but into adulthood. So typically, it's diagnosed kind of in your mid-20s, and it doesn't typically impact your kidney function, although sometimes it certainly can. Around 10% of people with MSK will develop end-stage renal disease and need either dialysis or a transplant at some point in their life. Again, this is a congenital disorder, so it is formed in you, like when you're born. There definitely is a genetic component, although it seems like it's not always genetically related, or we don't know the specific genes that are related to it, but it impacts you, and then you kind of have it for your whole life. And so treatment really, really focuses on treating the symptoms, which are primarily kidney stones and urinary tract infections. Those are definitely the two biggest things, which makes sense, because when you think about your kidneys have all these little tiny cysts on them, your urine can't get out, and so it just sits there longer than it maybe should, so it's maybe more likely to get infected. So that's why UTIs are more common, or it's more likely to sit there and sort of crystallize, which is why one of the reasons why kidney stones are more common in patients with MSK. MSK is diagnosed typically with sort of a family history, and most notably with imaging. So doctors will use a variety of methods to take a picture of your kidneys and see what's going on there. And of course, when they see all those tiny cysts, then they can say like, oh yes, this is definitely MSK. So diving into the kidney stone aspects of MSK a little bit more, like I said, it seems like most of the reason that kidney stones are so prevalent in people who have MSK is related to that urine that just kind of sits there. If you think about kidney stones from a chemistry standpoint, which I love to do because that's really what prevention comes down to, is sort of changing that urine chemistry. When urine is sitting there and it has, calcium and oxalate in there, like all of our urine does, it's like hanging out in your kidneys longer than perhaps it would be otherwise because it can't get out because of all those tiny cysts. It basically has more time to sit there and form cysts and form form crystals and form kidney stones. And so that's probably the biggest reason why people with MSK form more stones. There also is a little bit of data that shows that there may be changes in how the actual kidney cells function that results potentially in higher levels of urine calcium in their urine and potentially lower levels of urine citrate. I know I've talked about citrate before, but citrate is a very powerful inhibitor of calcium-based stones. And so some people form stones simply because they don't have enough citrate or other kidney stone inhibitors in their urine. Not just simply having lots of calcium in their urine or oxalate, for example. But it seems like there may be something going on with like the kidney cells are doing some weird things resulting in that higher calcium and lower citrate. But definitely it seems like most of the reason why people with MSK form stones is, again, because that urine just kind of sits there. So it has a longer time to crystallize and form kidney stones. So when we think about kidney stone prevention, honestly, the tenets and the approach to prevention for people with MSK is the same as every other person with kidney stones. It really comes down to that 24-hour urine test. Because unfortunately, there's not much we can do to change the anatomy of the kidney and those cysts, right? Once they're there, they're there. There's not a ton that we can do to change that. And so what we have to do to prevent stones is we have to look at that person's 24-hour urine test to understand exactly what's going on in their urine that's forming stones for them, to help make it less likely that as that urine is sitting there, that it crystallizes, right? And so then prevention comes down to the exact same things that I always talk about, which is getting that urine test, identifying your urine risk factors or exactly what's going on to form stones in you, and then making dietary and lifestyle changes to target those exact things that's going wrong in your test, in your urine, basically. And I know I talk a lot about a 24-hour urine collection. And if this is the first time that you've heard me mention it, definitely go back and check out episode 59 of the podcast, where I talk about how to get a 24-hour urine test. And I touch on a little bit more about what that urine test is and why it's so important. So when we think about prevention for people with MSK, again, it's going to come down to that 24-hour urine test. Most of the stones seem to be calcium-based for people with MSK. Obviously, you can also get struvite or uric acid or cysteine. Well, maybe cysteine stones, but it seems like definitely most of the stones for people with MSK are calcium-based, which is very much the same as the general population. Typically, calcium-based stones are going to be formed because of high urine calcium. That definitely seems to be the biggest driver of of kidney stones in general, and also calcium-based stones, because most of the kidney stones in the general population, somewhere around 80% of the kidney stones that we know of out there are calcium based, either calcium oxalate or calcium phosphate. And both of those stones are typically driven by high urine calcium and or maybe some other factors, but high urine calcium definitely seems to be the biggest driver. And so we just are going to talk about the same thing. If I'm working with someone with MSK, we're just going to be talking about the same things, looking at their urine and seeing what's driving it. And if it is high urine calcium, then we're going to be talking a lot about making sure we're not eating too much salt, making sure we are not eating too much non-dairy animal protein, making sure we're not eating too much added sugar, being careful to avoid calcium supplements, but also making sure to get enough calcium from food sources whenever possible to help keep that oxalate down. And you kind of just do this, kind of fall into the same rhythm. So I know I've been getting so many emails lately and comments from people who say, I have MSK, can you still help me? And my answer is yes, absolutely. So yes, when you have MSK, you're obviously more likely to form stones, but there are still tons of things that we can do to change that urine chemistry to reduce the risk of you forming stones, even though that urine may be sitting in your kidneys longer because of all those cysts. And there isn't an MSK diet, just like there isn't a single kidney stone diet. That notion is completely bonkers. And there isn't even a single diet for a kidney stone type, right? So, there isn't a calcium oxalate kidney stone diet or a calcium phosphate kidney stone diet or a uric acid kidney stone diet. We really have to look at your urine chemistry. We have to look at your 24-hour urine test to know exactly what we can do to prevent stones for you, because there's this, the same type of stone could be formed by very different things. And the same is true for people with MSK. Just because you have MSK doesn't tell me what I can do to prevent stones for you. I have to look at your urine. I have to know why you're forming stones and how we can help improve that urine chemistry, whether it be getting that urine calcium down or getting urine oxalate down or getting up things like citrate or magnesium or changing the pH of your urine, right? There's tons of different things that we can do with diet to help improve that urine chemistry to make it less likely that you form stones. So that's really all I have for this episode. I know it's a short one, but I've been getting so many questions about MSK lately. I wanted to address it because I think it's a really, really important topic. Again, it's a rare condition, only 1 in 5,000 people or so in the US. But since I work in kidney stones, I do get a lot of people with MSK, because obviously most people with MSK do have stones. And I just want to put the message out there that there is absolutely hope. Just because you have MSK does not mean that you are destined to have stones for the rest of your life. There are things that we can do, a whole lot more than just drink more water. There are definitely things that we can do to reduce the risk of stones for you. I've worked with many people with MSK, both at the University of Chicago as well as in my course, and I've stopped stones for some of them, and for some of them we've made stones less common, and both are really, really great things, right? So there is hope. There are things that you can do to prevent stones with MSK. We just have to get that 24-hour urine test to know what we can do to prevent stones for you. So with that, I will end this episode of the Eat Away Kidney Stones podcast. I hope it was helpful and informative for those of you. Even if you don't have MSK, you can always learn about health conditions that perhaps you haven't heard about before. Awareness is always a good thing. And I hope to see you next week on the podcast. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.